Greetings, Eric Bakker, naturopath, author of Candida Crusher. Thanks for checking out this video today. I've got a question here from somebody in Australia, in Sydney, Australia. What are the symptoms of severe vaginal yeast infection? So, the symptoms of severe vaginal yeast infection can be a little bit sometimes mistaken for bacterial vaginosis. Symptoms generally include itching and sometimes severe itching. Itching can be so bad and really uncomfortable. I've had some patients who can't work anymore because of the itching. Itching, redness, discharge is quite common. Discharge can be a clear, white, thinnish discharge up to a thick, almost like cottage cheese white discharge. But the two characteristic symptoms would be itching and discharge. Okay. Now, BV or bacterial vaginosis is that fishy odor or the foul smelling vaginal area. Okay, generally there's not a really bad foul smell with bacteria, with a yeast infection, vaginal yeast infection. There can be a musky sort of odor, but not generally a really fishy, strong sort of smell. We get that more with bacterial vaginosis. So bacterial vaginosis will also have more of a whitish or a grey waterish discharge. Itching can be there, but nowhere near as intense as the vaginal yeast infection itch, which can be really bad. So I've also found many women complain about a lot of pain after intercourse with the Candida yeast infection as well. They also get it with bacterial vaginosis, but even more so with the vaginal infection. So the key symptoms are those two things. Think about the itching, think about the discharge. Okay. Now, some women with Candida yeast infections also get pelvic pain, different degrees. Many of them can even have a low-grade endometriosis without even knowing about it. I discovered years ago that many cases of severe endometriosis are in fact caused by a yeast infection. Now, it makes sense because if you've got a vaginal infection and you're going to treat it with applicators, creams from the doctor, and you're going to take diflucan or fluconazole recurringly, to cure this problem. You won't cure it with drugs. You won't cure it with creams. What you do is you're driving it further up the vaginal area, okay, in through the cervix, into the endometrium, and then eventually you get endometriosis. So you get basically an inflammation in the wall there, in the wall of the womb. Yeast actually can get through there and start creating an immune reaction. Cysts will develop, small cysts develop then around that area, and that becomes endometriosis. Endometriosis has skyrocketed since tampon use with many women. So I've got a female doctor friend who said that she found years ago a massive connection between endometriosis and chronic vaginal yeast infection. Okay, so you need to bear that in mind too. You could have a low-grade pelvic pain. Okay, so if in doubt, make sure that you get checked out and have a swab and have that cultured for Candida. To see whether you've got a bacterial problem in the vaginal area or a yeast infection. Be sure to check out my other videos on how to get rid of a woman's yeast infection by doing the kill and the build phase. This is a bulletproof way, 99% guaranteed to get rid of this vaginal infection. Thanks for tuning in.